blood pressure not having time to adjust to the change in position. It's even more pronounced with elderly people, so it's important if the person is in a lying position, help them to a sitting position slowly. Allow them to adjust to that sitting position, and then after a few seconds to a minute, have them stand. If the person has been sitting in a wheelchair, ask them to get to the edge of the chair and sit very upright and adjust a little bit to that position before attempting to help them stand. All these measures will allow the blood pressure time to adjust to the changes in position. Because the heart is less efficient, the elderly may tire more easily as well, and frequent rest periods may be needed. Factor that into your day. It's not uncommon for an individual after breakfast and bath to need to have a morning nap before they can partake in any other activities. Fatty deposits can form on the inner walls of blood vessels and cause narrowing and rigidity. Blood pressure can rise as a result of that. High blood pressure can damage the heart and kidney functions. Report any signs of high blood pressure. Some of the signs that the patient might report would be headaches, dizziness, flushed skin, or blurred vision. A healthy respiratory system, the organ that's involved in breathing in oxygen and exhaling carbon dioxide, is required in order to be physically active. Lung efficiency decreases with age. This is caused by years of exposure to harmful substances, things like pollutants in the air, tobacco smoke. Also, lung efficiency can be decreased due to lung disease. Breathing capacity of lungs is reduced, and older people expend about 10% more energy than younger people do to breathe. Lungs become less elastic, making it more difficult to cough and to expectorate phlegm and other items from the lungs. Elderly, as a result, are at higher risk for the development of respiratory illnesses and the flu. If you've been in healthcare facilities recently, you've probably noticed that there are signs everywhere in the halls and also in the elevators cautioning you that if you have flu-like symptoms or have respiratory problems, please do not visit the elderly and other compromised individuals because they are more susceptible to illness. If you, as a caregiver, have been ill with a respiratory infection and all the signs of the respiratory infection have gone except for a nagging cough, and it's probably all right for you to return to work, but it would be important that you wear a mask when you're around these residents if you have a lingering cough. Breathing exercises, elevating the head of the bed, and limiting exposure to others that are ill will help prevent respiratory infections. Healthy muscles and bones are essential for activity and posture. With increasing age, natural changes occur in the musculoskeletal system. There's a decrease in the bulk and number of muscle fibers. Though this leads to some loss of strength, endurance, and ability, the loss is not as great as one might think. In most people, there is still enough strength and agility to remain mobile. If any of you have watched the Boston Marathon, you will notice the age span of the runners goes from very young individuals to very old, as a testament to the fact that with practice and training, people of an older age can maintain a lot of muscle strength. Leg, arm, and neck muscles may become stiff, resulting in decreased range of motion. The cartilage of the joints can deteriorate, causing stiffening and pain, and reducing the ability to walk and maintain balance. Range of motion exercises can help prevent contractures. Contractures are joint stiffness that occurs and deformities, as well as range of motion exercises can limit the amount of atrophy, which is shrinkage of muscles. Every person should be encouraged and enabled to perform the maximum activity possible in order to maintain an optimal state of flexibility. Bone mass is progressively reduced with age. The spine and discs can narrow and collapse, affecting a person's posture and stature. That's what gives some elderly people a very stooped appearance. Some elderly lose 1, 2, and even more inches of height because of this spinal deterioration. Osteoporosis, also known as bone loss, may occur mainly due to a loss of calcium in both men and women, and estrogen, particularly in women. Bones become more porous, which can lead to fractures. Both men and women can reduce the incidence of osteoporosis by increasing their intake of calcium and certain medications. Calcium-rich foods such as beans, milk, cheese, yogurt, and other dairy products can help and should be a part of their diet. Exercise, too, will help maintain and even increase muscle and bone fitness. In fact, the reduction of exercise, often seen with older people who are afraid of falling, may actually increase their risk of falling by contributing to muscle and bone weakening. That means if you work in a facility that has both an elevator and stairs, if the individual is appropriate, assist them to take the stairs sometimes instead of always using the elevator. Walking, jogging, dancing, walking in place are all kinds of weight-bearing exercise can go a long way in helping keep an individual's physical ability the best it can. The gastrointestinal system includes the digestive tract from the mouth to the rectum. Of all of the body's system, this is the one system that's most likely to cause distress in the elderly. Eating habits can change with age. Sometimes this is because tastes change.